Good morning and good afternoon to most of our participants. Thank you so much for joining this kickoff, first edition of a new seminar series organized by the Environmental Health and Pollution Management Program, funded by the World Bank and implemented by with the GEF. Today's first edition will be about the health impact of mercury pollution from artisanal and small-scale gold mining. We have the pleasure to have among us distinguished speakers with experience in the sector. But we will start with our dear manager, Eli Baroudi, who is the manager for West Africa, for environment, natural resources, and blue economy. But before that, let me turn to Heather to give us some housekeeping. Heather?
Yes, thank you very much, Maggie. Welcome, good morning, good afternoon to all invited guests. Please be aware that we have enabled a simultaneous English and French translation for this meeting. And so we invite you to enter either the English or the French channel for the call. So if you can kindly navigate to the menu function or the toolbar of Zoom, which should be at either the bottom or the top of your screen. If you navigate to the far right, you'll see a circle with 3 dots inside for more. If you select it, and you can find on the drop-down list, translate or interpretation, excuse me. Select interpretation. And the icon should appear in the toolbar, and then you can select interpretation again, and you'll see an option for original, English, or French. And you're kindly invited to choose either English or French. And then we'll get started. Thank you very much. Maggie, back to you.
Thanks. Eli, I'll let you come in and tell us about the World Bank's contribution to this important topic. Eli, welcome.
Thank you so much, Maggie and Heather, and it's a real pleasure to be with you. Hopefully you can all hear me well, but it's a significant pleasure because this is the first in a series of meetings we're going to be undertaking. So a huge and warm welcome to our speakers in this inaugural webinar. That's a part of a series on environmental health and pollution management. As part of this work that we're doing under the Africa Environmental Health Pollution Program, I'd like to also thank the representatives of ministries and agencies of the countries that are already working with us. We have Ghana, Kenya, Senegal, Tanzania, and Zambia amongst those countries. I myself am based in Senegal, Africa West, and covering a number of Africa West countries, and this is a significant problem. I mean, pollution is all around us, and everywhere we go, we hear of the issues. And these are leading factors for mortality and morbidity, and so really impacting significantly low and middle income countries in particular. Small-scale gold mining, often informal sector, this extraction has significant health impacts, it has environmental impacts, it has social impacts. And of course, the gold mining that we're seeing today is the artisanal sector, accounts for really 38% of total global mercury emissions and releases more than 1.2 tons of mercury into land and water annually. So very significant impacts. And we all know that mercury is so toxic, right? Toxic to humans, to animals, and the environment. And you've got children working in this informal sector often. So the damage there to the nervous system, immune systems are significant. So I really feel this is an important topic. I'm glad we're able to cover it today. I mean, we know that this exposure is not necessarily national issues that our countries face, but also regional and global issues. And so this also, we're looking forward to hearing what we can do more on the global collaboration under international conventions, such as the Minamata Convention. So really the World Bank with the Global Environment Facility is doing its part. We can probably do more. So also looking to hear how we do that. This particular program, the Environmental Health and Pollution Management Program, is really trying to reduce exposure to mercury pollution, strengthen institutional capacity, and really look forward at how we can finance country level and regional activities that promote the awareness, promote capacity of dealing with this, put in place state-of-the-art knowledges and practices to reduce these emissions, and make sure we can get that goal, but get it in a way that is a lot more sustainable and healthy. So on that note, I mean, this is the first in a series, so looking forward to hearing how this goes and looking forward to everybody's feedback. But beyond that, we'll go into having sessions on other toxic chemicals, but also electric and electronic waste, for example. So on that, Maggie, really looking forward to hearing what the speakers have to say, and I hand back to you at this point so you can let us know who they are. Thanks a lot.
Thanks so much, Ellie. Thanks for joining us from Dakar. Thank you. Let's now turn to Dr. Stephen Bose-O'Reilly, who is the head of Global Environmental Health and Climate Change Unit, Institute and Clinic for Occupational, Social, and Environmental Medicine at the University of Ludwig Maximilian in Munich, Germany. Dr. Stephen, thanks so much for really being our guide on this important topic. You've traveled across many mining sites in Africa and researched the impact of mercury poisoning. What have you found? Please let us know, give us some insight about the research part of this important topic. Thank you, Dr. Stephen.
Yes, thank you very much, Machi. That was a very, very nice introduction, very kind. To all of you, I live in Munich in Germany, and we have the big beer festival here at the moment. It's a very toxic substance as well, as you might know, and maybe I'll come back to the similarities between mercury and beer. You can see my slides, or? Okay, and you can hear me as it looks like. Okay. Good, so let's start. I want to say a little bit about the health effects, the chemistry, the signs and symptoms. Then I will come to the main topic, the global burden of disease related to ASGM. I will have to explain a little bit how you get to this burden of disease. Then I will clarify why this sounds so difficult, chronic inorganic mercury vapor intoxication. And then I will show the results, especially on Africa. And then in the discussion, I want to widen up how we look at ASGM and health issues. And Machi, you give me a sign if I'm running out of time, yeah, because I really would like to get to the end. The one thing is that we all come from very different sectors here at this meeting, and some of you know exactly what I will say in the beginning, and some of you know exactly what I will say in between, and so on. So please forgive me that for some of you it might be a bit boring, some of these slides, because you know them, but we are a very, very mixed audience. So I tried to get all of you involved and a bit of news for all of you as well. You already mentioned the Minamata Convention, and the Minamata Convention is fantastic. This Minamata Convention on Mercury is existing since 2013. It's under UNEP mainly, but many other UN agencies and countries are involved. And it's a globally legal binding instrument, which is very good because it's good to work under this kind of instrument. And here I highlighted a few words in red and green. The objective is to protect the human health and the environment from emissions that are man-made and releases of mercury and mercury compounds. So I'm coming from the health sector. I'm a pediatrician. So if I want to protect the children in mining areas from mercury, I need you environmental guys to clean up the area, to use alternative technologies to avoid mercury emissions. But if you environmental guys want to know why you do this, it's because you protect the health of people. So already in Article 1, it's very well that it's on health and environment. And, me coming from health, my main purpose, of course, is to convince you that health is an issue in this topic, not only the environment as such. There's a specific article, number 16, on health, for example, which is very good, that health is so well, in this UNEP, which is an environmental agency, included. So I'm coming now to these health impacts. The first one is mercury has a little bit of difficult chemistry. You can see on the picture very nicely. Here you see the liquid mercury, and this is the elemental mercury. This is how it occurs in nature. And this is, if you have a spill like this, it evaporates easily, and we all inhale this mercury vapor. We inhale it. So we inhale mercury vapor. It can enter the body, and it can even enter your brains. And it doesn't smell, which is difficult for miners because it's not a toxic substance that you can feel, like, for example, air pollution. And of course, it crosses as well the placenta, and it's concentrated in the fetus, which is very worrying for me as a pediatrician, as I said. Next one is metal mercury. It's in fish. So this is another way of mercury, but we can ingest this. So we can eat this kind of mercury in fish. In ASGM, it does not play a major role. It can if the rivers and the water bodies are contaminated, and then it can enter the aquatic food chain. But mercury emissions mainly contaminate the water with elemental mercury, and then downstream this methylation happens, and then we have a problem in the food chain, in the global food chain. So this is why we want to protect the waterways from mercury. And it's a very toxic substance. I just mentioned the Minamata disease, which is a tragic historical episode of chemical pollution, and many people very severely diseased and poisoned. And then, just to say the whole story, there is mercury salt, inorganic mercury salt. It's, for example, in skin lightening creams. But since it doesn't play a role in ASGM, I will skip this. But just to say, there's 3 different forms of mercury. This is a slide from World Health. They have a fantastic slide set on mercury. The last 3 slides were from this slide set. And here it's a repetition. So you have metal mercury in fish. It affects the brain and the fetus. You have the skin lightening creams. It's mainly damaging the kidneys. And then you have the miners here catching the gold, and it affects the kidney and the brain. So this is these different ways of pathways that we can get intoxicated. Just a repetition for those who are not so familiar with ASGM. Most of you are. Here you have the miners with the ore, which is already milled and fine ore, and they add liquid mercury to this ore to form an amalgam. The amalgam is the mixture of gold and mercury. And to get the gold out, they heat up these amalgam pieces here. They heat them up. And the problem is that the mercury evaporates and the gold stays. And you inhale this. So you see how these guys are next to this place with absolutely no personal protection or anything. And as I was saying, inhalation of elemental mercury is the pathway, and it's a very toxic. So this is the dangerous pathway. This is why I'm repeating this. We did, and I was kindly enough introduced, work in many countries, and we did health assessment in 7 or 8 different countries, and we looked at the miners' health. And we did find very serious neurological effects of these miners. So heavy symptoms like they have problems to walk straight or coordinate their movements, or tremor. These are medical terms, but nevertheless, they had serious problems with their brains after many years of work, and they had high mercury levels of mercury in blood, urine, or hair. And if they have a combination of this, we call this a mercury intoxication. We have an algorithm for this, because if you have high levels of mercury, you can have less symptoms and so on. But when we combined these different countries, we had control areas, beautiful areas where no mining is occurring. For example, in Mongolia, there was absolutely nothing next to this. And then nobody had a mercury intoxication. Low exposed means people living in mining villages, exposed by the environment, not occupationally. And they, in around 20% of the cases, had already a mercury intoxication, which is visible. And the people working, like the panners, had in 40%, and the smelters in about 50% a mercury intoxication. We published this in a series of publications. You can all find this on PubMed if you want to. I just said it takes a couple of years to develop these symptoms. This is coming back to alcohol. If you drink alcohol over a long period of time, you damage your brain. And for example, you get this tremor, this shaking. And it's the same with mercury. You need many years of exposure, and then you get this tremor, this shaking. And it's very similar. And the severity is similar. And maybe you know as well, if you have such problems like tremor, they're irreversible. So even if you stop the exposure, people don't get healthy again. And in the beginning, they don't feel this, but in the end, after 15 or 20 years, they have this exposure. We saw this when we looked at how many years people worked and so on. So far about health and chemistry. And now I'm going to the main topic, the global burden of disease. And the first one is a very nice slide I did steal from somebody. Hope this is okay. We call it the disability adjusted life years. Now I'll try to explain this. So if a little baby is born, usually it's a very healthy baby, and it has 80 years of life expectancy. So expected life years is 80, for example. And then, of course, there's a little disease in the beginning, and then there are more and more diseases over time. And after a while, you don't feel as fit anymore. You lose capacity. Let's say you have a stroke here, and you already have problems to move your fingers. And then you have a severe stroke here, and you lose the capacity to speak. And of course, these are these years lived with disability. So the more severe a disease is, the more it should count into this.
Good morning, good afternoon, and good evening, wherever you are based at the moment. My name is John Yabe, and the title of my presentation is The Impact of Research on Policy Experiences from Zambia. So my presentation will be based on 2 projects that were done in Zambia. So this was a project called Kampai Project, which was sponsored by JICA. I was the team leader on the Zambian side. And then I'll also talk about the project that was funded by the World Bank. This is the ZEMREP project, and I was also the principal investigator for this study. Before I talk about the project, I want to introduce Kabwe, which is a town in the central province of Zambia. This town has a lead zinc mine that started from 1902 and officially closed in 1994. So the mine has a legacy of lead contamination, cadmium as well, but lead is the main pollutant. As a result of extensive environmental contamination due to lead, the town has been classified as one of the most polluted places in the world. So because of the lead contamination, our study team investigated some of the exposure factors in the environment. What we found was that in the mining area, there is the Black Mountain, where people used to climb on the mountain and scavenge for some scrap metals that they used to sell. There is also access to the Black Mountain, which is highly contaminated with lead, so children had access and would play there. And also allocation of houses just close to the mine dumps was one of the factors, and also children and women crushing stones that they used to sell. This was quite close to the mine dumps. There is also this central canal that used to drain the mining area. So this was also a source of contamination because it's highly polluted with lead, and after flooding, the water would reach the residential areas. So to investigate the extent of metal contamination, especially lead, we started a project which was called CAMPI from 2016 up to 2022. So the main focus on the health aspect was the human health risk assessment and socio-economic impact of lead pollution in Kabwe. So we looked at a number of objectives like blood lead level concentration in households, breast milk lead examination, urine and fecal samples to check if we could use them as non-invasive parameters, IQ analysis, which was cognitive. We also assessed the quality of life, neurodevelopmental impairment assessment, and social impact impact assessment. So this project, it partnered with the ZEMREP project, which was a project funded by the World Bank through the government of Zambia. It also partnered with Pure Earth, which was conducting remediation at the time. So just to summarize the findings, we found that townships that were close to the mining area, Kasanda, Mapululu, Choa, had the highest levels of contamination. Some of the townships had houses that were even as close as 100 meters away from the mine dumps, which was highly contaminated. Some of the townships that are far away from the mining area had levels of lead in the children that were much, much lower. The highest concentration that we found was 162 microgram per deciliter. And we looked at the distance and the wind direction. These played factors. And then we found that the highest contamination or concentration in children was around the age of 1 to 2 years of age. So what we found was that blood lead levels in Kabwe were high. Breast milk had concentration of lead that were low, so it wasn't of significance as a source of exposure. We also looked at free-range chickens that are scavenging near the mining areas were also a major source of exposure to humans. Children were exposed to lead through the mother's blood and also from the soil. We found that lead had an effect on the liver, kidney, and the hematopoietic system of the people that were exposed. And then we also found that dogs had similar exposure parameters as humans, so these could be used as sentinel animals. We also identified the hotspots that were supposed to be considered for remediation. So we partnered with the ZEMREP project, like I mentioned. This project had the component of treatment. The CAMPI project that was sponsored by JICA had no component of treatment. And also the CAMPI project had no component of remediation, but it developed techniques that could be used for remediation, and these were implemented by the ZEMREP project. Then what was also done was neurodevelopmental impairment assessment, cognitive assessment, learning disabilities, as well as pregnancy outcomes in mothers. Then I will talk about the Government Republic of Zambia project that was sponsored by ZEMREP. So the objectives were to reduce environmental health risks, including lead exposure to the local population in critically polluted mining areas in Kabwe, Kitwe, Mufulira, and Chingola. This project had a component of health interventions and using dim circulation therapy. It also had a component of remediation of the hotspots, livelihood and income generation, as well as education awareness. Now, the research project screened in the first phase over 14,000 children below the age of 16 years of age. Of these, 1,500 were commenced on chelation therapy using DIMSA. Then support therapy included nutritional supplementation. So this was useful to reduce the absorption of lead from the GIT. Then we also looked at sustainability plan. At the end of the research project, what would happen was to continue lead monitoring through the normal procedures of the Ministry of Health. And to do that, the project established a monitoring laboratory, which is supposed to routinely investigate in the environment as well as in the exposed children. So what we found was that when you look at lead and anemia, we found that children that were exposed to lead had low levels of HB. This was a new finding in Kabwe. It had never been done before. So this indicated that whatever we are doing, we are also supposed to consider that anemia could be one of the important things to look at in Kabwe. Now, we disseminated this information that we gathered through the various social media platforms, radio stations, television, and also we engaged with the government authorities during our conferences and presentations. So this message reached the government, reached the various stakeholders, and then some remediation or some actions were taken to reduce exposure of children to lead. So one of the things that was done was capacity building through the Kampai project, which was sponsored by JICA. This was done at the University of Zambia. So the project installed a graphite furnace atomic absorption spectrophotometer. It installed an MPAES for lead analysis. The project also installed a direct mercury analyzer, DMA80, as well as microwave digestion system. So on this picture here is the mercury analyzer. This is on the bottom left is the AAS, and then on the top right is the MPAES. So this enhanced capacity for lead analysis and monitoring on a continuous basis. So under capacity building as well, the ZEMREP project, the one that was sponsored by the World Bank, also established a monitoring laboratory in Kabwe. So this installed an ICPMS, and also this on the top, the picture on your left is ICPMS installation and training that was done. On the right is after installation is done and the machine is in use. So today I actually visited the clinic in Kabwe. I'm currently in Kabwe. I went to the laboratory and checked on the works that were done, as well as the analysis that is being done in Kabwe. So another thing that was done was environmental infrastructure and remediation interventions. So on the left picture is the central canal that used to flood annually. So this was dredged, and you can see that it was widened, and there is a concrete that was held on the sides and on the floor so that it can carry large volumes of water without flooding. So this is something that came out as a positive outcome of the project. I went there today as well, and I saw that this canal is ready. In the rain season, we will not see any flooding that will happen. Then the Black Mountain, or the tailings dump, the mine waste where people used to have access. I was there today and I took this picture today. You can see that this place has been fenced off. There is no access now by children and women that used to crush stones on this Black Mountain. So this is a positive thing that shows that at least the reports that the projects are disseminated are yielding fruit, as some of these remedial measures are being taken. Another thing that was done, and I was also there in these places, the in-situ remediation. So what was done was dust suppression. Some schools, clinics, and play parks were paved to reduce access to the contaminated dust. So this is something that was also positive. And some schools received some boreholes to encourage planting of some vegetation, some grass and hedges. So this was done to improve dust suppression so that contamination could be kept at the barest minimum. Another thing that was done is education awareness. So this was done in public gatherings, radio stations, hospitals, and also churches. So the information was disseminated to allow the people to have access to the latest information to avoid exposure to lead. And also education awareness was done, where the curriculum was also revised. So we included lead education and the awareness toolkit in the school curriculum, and this is being used to educate children on the exposure factors that can be reduced so that there is no contamination lead. So some of the activities that were done is education activities, some school play that were done, as well as some cartoons that were done. This is the Central Canal, where we can see this cartoon here showing the others not to play in the Central Canal, and also encouraging others to grow some plants and vegetation in their yards, and also to stop some children from playing on the Black Mountain, which has now been fenced off and they have no access anymore. So this work was done in conjunction with Kabwe Municipal Council, the government of Zambia. So this is the local government as well as the central government. Thank you for your attention. So these are some of the things that we've done. And since capacity has been built, both human capacity, laboratory capacity, there's opportunity to improve these works and to reduce the contamination even further. Thank you for your attention.
I do want to talk about how NGOs can assist governments in the process of dealing with mercury pollution. But I thought it might be useful for us also to put the scale of this a little more into context, especially around what's been going on within the UN agencies in different places. One way to do that is to compare the health impact of different chemicals in the world. And we've heard good evidence from Stefan about how much mercury is causing damage to people. We've also seen some analysis over the last year or so looking at all of the different chemicals that are out there, so we can compare how big this particular issue is, because it's one of the few chemicals that actually has an international agreement associated with it, with the Minamata Convention. So the number of DALIs here is actually kind of on the low side compared to a number of other chemicals. The number of DALIs here is similar to that comparable to chromium impact or polyaromatic hydrocarbons, which is a part of air pollution. However, there is a set of chemicals that have more impact than mercury in the world, and that includes pesticides, arsenic, asbestos, cadmium, and nitrates, which again is another component that is affected with air pollution. And there's one chemical that exceeds all of those by far, which is lead. So lead has in impact something like 60 or 80 times more disease than mercury does. The good news, though, if you're looking at these sort of things as a comparative tool, is that mercury causes more disease than PCBs, than PFAS, than endocrine disruptors, or brominated flame retardants and dioxins. So it's kind of in the low end of the middle spectrum of chemical agenda. So I think also, if we're taking a high-level look at how this work on mercury has progressed, because there's been a steady, albeit smallish, stream of funding that's gone out to really work on this because of the Minamata Convention. I think we can see some anecdotal successes that have gone on to assist governments in developing regulations and to actually implement mercury-free technologies amongst different groups. So I know that in Pure Earth, we've been doing this, for example, in doing site assessments with the government. We have 10 sites now that are being assessed, but we're measuring soil and water, we're looking at food to determine how bad the mercury levels are in these sites, and that can then influence government action. And similarly, we've done work in many other places in cleaning up contaminated soil, developing technologies to do this, in training miners to move away from mercury into mercury-free kind of processes, and in reforesting mercury-contaminated areas. And these are all core actions that need to happen in order for this issue to really stop being such a burden on us all. But I think if we look at the results, it's a slow process to go this direction of action at small levels, because the number of people who are working in this sector is enormous and growing. And the simple reason they're doing this is because the price of gold is very attractive, and it's an easy, perhaps toxic, way to make a living. So 600 people that you saw down in the depths does not surprise me at all, Margie. I think that would be quite what I would understand. And it's because gold is so useful. because of that, I think that the way that we would eventually make a serious dent in this mercury issue will be to see that there is a way where mercury-free gold is considered to be valuable out there, separate to regular artisanal gold using mercury. And so some way where the world demand for gold can actually be asking and be willing to pay this is a small premium for it, of course, but be willing to pay for that, I think is the way forward. And the premium there, if you go to one of the certification options, it's maybe 10 or 15%. But remember, gold fluctuates by much, much more than that on a semi-annual basis. It will go up and down by 20 to 50% without too much difficulty. So I think we have to find ways where people who are buying gold for investment or for jewelry value the fact that we're doing something with moral benefit, improving the lives of these people by paying for mercury-free gold. So I'll pause there and be more than happy to discuss any of these issues further. And I'm terribly grateful also, John, to see the good results that have been going on in Kabwe, a place that's always been so much a part of Pure Earth's work over the many decades. So I'm really glad to see that's is progressing as well. Thank you all.
Thank you so much, Dr. Fuller. We really appreciate your perspectives. Let's now have a Q&A for about 15 minutes before we give the floor back to Eli, our practice manager, for closing remarks. Yes. Scott Hanna, you have the floor.
So I'm part of the ENS team working with Bill Haken's group and Pravin Karki's group in the World Bank in Liberia, an area of hydro project that's extensively covered by artisanal mining, a lot of dredge mining, a lot of mercury used. My question is, if we can go to, say, mercury-free mining using borax or other methods, how long would it take before the mercury in the soils and the water would rectify itself over time? Or is this a permanent situation that will never be resolved in a generation? Over.
Do we have Dr. Fuller? Go ahead before we have.
Yeah, thanks. That's interesting. So mercury being heavy will slowly dissipate down into ground, but more importantly, it does get into waterways and then ends up in the ecosystem. And at that level, I would defer to Stefan to say whether there is a global reduction in fish stocks as time goes on if there were no additions into the environment. But Stefan would probably know that better than I.
It's very, very mean to ask a pediatrician about the environmental fate of a very toxic substance. But Rich, you're a very good example. You come from Australia, but you live in the US. In both countries, historically, there was gold mining in the 1870s and 1890s, where we have all these famous movies and so on. And they already used. And in Australia, there are still mining areas closed for public use. So in California, certain lakes you're not allowed to fish. So even so, it's 150 years ago. So the mercury which we release into the environment, unfortunately, does not disappear. It's a natural element, and it might be distributed, elsewhere, but it does not disappear. But I'm sure there are other people who can explain this much better than myself.
We have a world expert with Philippe Grangin here. Perhaps, Philippe, you'd like to chime in?
Excellent. Yes, Philippe, go ahead. Yeah. Hello, Philippe, you have the floor. Would you like to come in?
I would love to come in. I just had to switch on my mic. I wanted to emphasize that both mercury and lead are more toxic to the fetus and the small child than to adults. And so in regard to life years lost, or whatever calculation you want to do, the children will count a lot more than people my age, for example, even if I'm still vulnerable. So I think that we need to discuss how to emphasize prevention so that we put pregnant women and small children first. And I don't think we're doing that enough. And I think that there is so much scientific evidence out there that it's fine to do some monitoring, but we don't need additional research that shows that lead and mercury are toxic to the brain. We know that already, and we have simply not done enough to protect the developing brains, the intelligence of the future. And so I think it's unreasonable that we're taking advantage of nature and of the metals that we can mine at the expense of the next generation. And I hope that the World Bank will listen to this and take this into account in their priority setting. Thank you.
Thank you so much, Dr. Grosjean. Thank you. Ozgul, please come in.
Thank you very much. I'm Ozgul, environmental engineer in West Africa. I'm leading the Ghana leg of the project. I had a question, actually. First of all, it's well taken. Yes, like sensitization about prevention is something to maybe take as a lesson from this panel. But I also wanted to ask perhaps to Mr. Fuller in terms of some of the good examples for an enabling environment for the mercury-free gold premium payment. So especially for the value chains, have you seen any good best practices that could be implemented, particularly on the policy angle and also in terms of how the private sector is operating, so that we can also take that into account in our projects? Thanks.
It's a very good certification process. And Jen, perhaps I should turn it over to you to give a little bit more description on this. It hasn't yet quite caught on with jewelers, but I think there is a good chance that the jewelry group might start to prioritize this with its premium. Because if you look at the cost of a piece of jewelry or whatever, the actual gold is important, but there's quite a lot of additional costs, especially for premium jewelry, in the artisanal work itself, in the actual manufacturing of it, and gold becomes less important in the overall cost. Jen, would you like to chime in?
Yeah, thanks, Rich. Hi, everyone. I'm Jen Maraschino. So I actually threw a link into the chat that goes to a blog story about one of our most recent projects in Madre de Dios, Peru, which may have some different elements to Africa, but it's an extremely successful project funded by the jewelry industry, by a company called Brilliant Earth. It's a project where we trained miners in mercury-free technologies, gravitational separation, in this case, a shaking table. We also worked to give the miners the skills to ecologically close their mining concessions using reforestation, and they became Fair Mine certified. And I do see Bob D'Onofrio with Futura Jewelry. So we do have the jewelry industry on this call who's been using Eco Fair Mine gold for a very long time. I know he's a big proponent and supporter of this work. So, as Rich was saying, the Fair Mine certification created by the Alliance for Responsible Mining does result in a premium for the miners. Listen, it's complicated. We developing these supply chains out of remote locations such as Madre de Dios isn't easy. It involves working with refiners and such, and jewelers that are really interested in paying a bit more for these commitments that miners are making to the environment and to people's health. I do think there's a real growing set of knowledge within the jewelry industry. A number of us have been working extremely hard, working with groups like the Responsible Jewelry Council, the Watch and Jewelry Initiative 2030, Many of the smaller jewelers who are part of groups like Ethical Metalsmiths in the US have been doing this work. They've been sourcing this type of gold. They've been supporting this. It's not happening as much in the larger companies. But I do believe a shift is happening, honestly, thanks to a number of us in multiple NGOs and jewelers like Bob, who are really committed to spreading this word within the jewelry industry. It's a luxury industry. A lot of these companies are philanthropic and do have the funds to both help support the projects in the field and also be involved in the sourcing of the gold.
Thanks, Jen. So despite all this challenge, there is hope that things will be different. Things are changing. Ellie, did you have your hand up? Ellie?
I had my hand up and I was thinking, am I cheeky having my hand up? But I was struck by something both Jen and Philippe said. I mean, in terms of what we can do at the World Bank also. So, Philippe, my experience is limited, but it's mainly in Guinea. And Guinea has a very big problem with artisanal gold mining, but it's very informal. And I was wondering whether in your experiences, including Jen of the chain, whether it's formal or informal, do we need to, I'm assuming when we're looking at solutions, we're looking at slightly different approaches, but if you have any thoughts on the informal sector and how that could be dealt with, is something we're scratching our heads with.
I think we have colleagues at the World Health Organization who can help you out. I think that we have lots of experience in monitoring methods. And you can use hair samples if need be, both for lead and mercury. I published on lead, and hair mercury is, it's used all over. So those sampling procedures may be helpful. So monitoring is perhaps the first step, and then you have to get in with the best kinds of prevention procedures. Methyl mercury will concentrate and accumulate in fish. So it's very important to determine if there's some flow. Like I've studied this in Brazil, for example. When you wash the gold out of the sediment, then of course the sluice boxes will empty into the river again with some mercury, and also when you burn it. And that means a contamination of the freshwater fish. And in Brazil, it's the original population that we are contaminating. And even worse, it's the next generation. I think it's horrible what we're seeing in that regard. So I really hope that you, hopefully jointly with the World Health Organization and others, can get this going. Thank you.
May I just quickly point out that Project Gold, funded by the Jeff and others, which is run through UN Environment and other UN agencies, takes as a focus formalizing the informal sector and providing them with the services where they can join the formal sector and then begin to be able to take access to all of the mercury-free technologies that they need to work on. So that informal process, Project Gold, I think, is one of the good success stories.
We still have a few minutes before Eli can come for the closing remarks. Do we have any more questions on the floor? And I think Dr. Yabe is also back on the call.
Maggie, I see Bob, Bill, and George.
Oh, okay, go ahead.
Hands up.
I didn't see the hand, yes.
And Bob is waving profusely.
Go ahead.
Good morning, good afternoon. Yes, when the Minamata Convention came out, I asked to become a partner of the Minamata Convention after spending many, many years in the luxury jewelry business. And the reason why I asked to be a partner is because I think this battle is won through communications and education of consumers. We need pull and demand. And I know everyone else, everyone on this call is working where the real difficulties are. But before this problem gets solved, and Richard referred to it, it's slow and it's difficult in the value chain. So I started this jewelry company, Futura, back in 17, wishing not to do so. But my job with the UN is communication, education to the broader population. There are many jewelers around the world, as Jen alluded to, that are concerned about the issue and buy some of this mercury-free gold. But they're dealing in their very small communities, selling to very small people. No one is communicating. And I think one of the biggest issues that we can confront as a group, whether here World Bank or whether it be the UN, is we need to now maybe take up projects where we support people who can make a difference with consumers. That being maybe educators, it'd be people in the press and things, where we start letting them know the issue. And because no one knows it. Our biggest enemy in doing what we're all trying to do is called recycled, reclaimed, reused, because everybody thinks that's great when it comes to gold, when it has nothing to do with the problem that we're all trying to solve. So when I'm out in stores and I am out there and I'm doing presentations and things, no one cares or knows about this issue. They're happy if they like the jewelry and they hear that it's doing good, they're happy. Otherwise, I have to tell you, out at least in the United States piece, okay, no one cares. And I think these organizations like the World Bank, we need to look at this from the demand side at some point and start to help to pull the gold through the system. The system already is hard enough to fix, but we need to start to pull the gold where someone alluded to before, that it has a premium attached to it because it's right. And I think that's really where we ought to be spending some time. Thank you.
Thank you, Bob. Thank you. In terms of communication, I work with the different countries on communications, and most of them actually started a radio program where we invite miners, we invite people in the sector to come and radio and really build awareness. I think maybe we need to bring people like you also to this radio program so you can talk to women like me who go to the store and they think about the gold, but not about all the process.
Well, listen, I don't know if I'm still on. If I am still on, buying jewelry is a wonderful, joyful experience. No one wants to hear about all of the problems. And that's part of the issue that we face.
Thanks, Bob. You're right. Thank you. Thanks so much. George, would you like to come in?
Yep. Can you hear me?
Yes.
Yes, perfect. Hello, everyone. I'm an environmental specialist at the World Bank. I'm a team leader of a Central African Republic forestry and mining project. And my question was basically when this project was started in CAR 7 years ago, that we could not find any mercury being used in artisanal gold mining. And since in the last 5 to 7 years, it's basically spread everywhere across the country. And, the gold market in CAR is very focused on Russia and China as end users. And I have some skepticism whether, those markets will have this type of price pressures on mercury-free gold in the near future. So I was wondering if there's good examples in terms of setting up a monitoring regime and setting up a monitoring of mercury contamination and awareness raising. Is that enough? Is there good examples of that affecting change in a country? Or do the pressures of putting food on the table and the good incomes that the gold mining can bring to families in a very poor, marginalized setting, is that does that override any kind of awareness raising monitoring that can be put in place?
Yes. Thanks, George. Maybe Dr. Yabi, Dr. Stephen, would you like to come in?
Not really.
I'm happy to make a quick
Yes.
comment. I think John would be better, but just in lieu. You know, these folk, as we've all seen, as Stefan showed so very well with that chart of looking where their health issues are, mercury is not a major concern for them. It's because it's has such long tentacles and is a problem for people around the world eating tuna fish that we place so much focus on it. And I think that the issue here will require some external kind of force to be able to bring focus to folk who are really just trying to put food on the table more than anything else.
Well, thanks so much. Maybe now we'll give the floor to Ellie to give.
Matt.
Sorry, there is Bill who's been very patient.
Oh,
I
go ahead, Bill.
agree.
I don't see the hands. Yeah, Bill, please go ahead. Come in.
And maybe really quick, Bill, if I can interrupt you, just sorry, before you do, just a quick comment to all participants. If you'd like to receive the recording of this session, as well as the PowerPoint and other materials, and you have not yet done so, kindly open the chat and share your email with me, and I'll make sure that you receive that material. Bill, apologies. Over to you.
We have Bill, then Ernesto, then Nishal. We'll take all three questions. Thank you.
Okay, thank you very much. As Scott said, we're working on developing some hydropower projects here in Liberia. There's very little, if none, no data currently shared. We are, however, collecting data. So the first question I have is, are there any World Bank funds potentially available for helping us set up in-country monitoring and testing programs here in Liberia? The second one is the issue of prevention. Yes, a lot of the gold mining that's happening here in Liberia is on river, and it is strictly illegal. So we hope that we can get the government involved with that. The third thing is cleaning up contaminated soil, especially for a hydropower project, where we want to ultimately, at some point in the future, impound water behind the dam where there is existing mercury entrenched or there in the gold mining. So we have to clean that up. And I'd be interested to know if there's any experience in the group here of places where gold mining areas have been cleaned up before inundation by a reservoir. Thank you.
Ernesto, would you like to come in? Then Nishal. Thank you. Ernesto? Or Nishal, can you come in?
Let's go first with Nishal, and I only have a very short announcement before Ellie speaks. Nishal?
Yeah. Thank you, Ernesto. And thank you, everyone, especially Environment, Health, and Pollution Management team for organizing this. So I'm currently conducting this scoping study on gender and ASGM in the context of artisanal scale and gold mining. So I'm mostly looking at the gender aspect, how each genders are impacted, right? So if any of the panelists could highlight if there is any link between lead exposure and gender-based violence, why we hear the health impacts such as respiratory issues or premature death and low birth weight. So it would be very helpful if anyone could highlight on how can we better support women and these marginal communities who are dependent on mining, especially when these alternative livelihood options are very limited. So yeah, if anyone could highlight on this front, that would be really helpful. Thank you.
Thank you.
Thank you, Nishal. And I want to thank everybody for your participation in this webinar. Regarding your question, Bill, the bank is working on these topics in several countries in sub-Saharan Africa. If the government of Liberia is interested in getting banks assistance on these topics, we just need to get a formal request, and we'll be very happy. The bank will be quite happy to provide technical assistance and investments in this area. Now, as Ellie mentioned before, this is the first of a series of webinars, and we're organizing a webinar on the role of the private sector in building mercury-free value chains to end, and that's going to take place at the end of January. And we're going to be inviting all of you, including Bob and Rich, and we expect all of you to participate in all of these webinars. And thanks again for your participation today. Maggie?
Thank you. Yes, we'll pass the floor to Ellie.
Yeah, Maggie, I won't take long, but Ernesto, don't forget Jen and all those lovely examples she was giving for the next webinar that involves the private sector, and maybe even Bill in the perspective of large and small industries going forward. Look, I don't want to take too much time, but I wanted to really add my thanks to the team. I found this super, super helpful, and I hope everybody else did. I mean, everything from what Stefan said in terms of, opening our eyes, that it's not just a health impact of the particular chemical, but it can also be a wider process. And of course, what we heard in terms of Africa is striking for me as well as someone in my position. So, I think we will certainly do our best to continue to try to do more in this space. A lot of you mentioned competing priorities, and it's the same with the governments we're working on, right? Sometimes this just falls to the bottom of a long list of things they need to do. But I think our job, given the impacts on health, and I love the way it was put to us, right? You're stealing the intelligence of the future. You're damaging that by not addressing it. So the impact, I think, is long felt on the human capital, on people, on their health, and therefore it's going to be on the economy. I was also really struck by the suggestions that were made on solutions, and I think from Dr. Yabe on the Zambia example, and from our colleague in Tanzania, there are solutions, it's clear, but also what the discussants mentioned, and also from the Q&A, there are solutions that often have to be tailored. And I think the thing that struck me most was try to be as upstream as you can, right? If you can focus on the preventions before it reaches where, it's out there in the system and very difficult to get rid of. That's something clearly to do. I was inspired by the examples, even though they're still small scale, and maybe they'd be nice to get to scale on what we heard from Rich and others. So you've really given us a nice sort of a menu of opportunities to think through. Ernesto is our point of contact. If anyone does have questions on this particular project, please do reach out to him. George and Usko, you heard on questions on Liberia. So if we can really work with our colleagues in country to also make the linkages on particular problems, if we can be helpful like that would be good. At least dots connect to a network. And I think that also is something we can help with. So just on that note, I know we've gone a few minutes over. I really wanted to thank you all for this and your participation and sharing with us your knowledge, taking the time to do that. And hopefully through Ernesto's work, through the fact that we can take these seminars forward, the webinars, make them more public and encourage this networking as well, I hope we can continue contributing. So on that note, Maggie, back to you, but a huge thank you from me to everybody.
Thanks to all, and we will see everybody in November for the next edition of this webinar series. Thank you. Thanks.